However, not everyone's story is this tragic. Some drivers are pulled over before they cause a collision. Roger Sandberg, a local defense attorney, told us this story.
Same scenario as a regular DUI up until the point that you refuse. They do the field sobriety tests, they establish probable cause to arrest you, and then they take you to the police station. They ask you if you want to take a breath test. At that point, a person refuses, and they have a choice to make whether they want to try to get a blood test or not. If they want to get a blood test, they have to call the judge. Usually it's 2 a.m. or thereabouts, and they call the judge. They have to tell him the facts thus far. We pulled this person over, and he admitted to having consumed 6 beers, at a bar, and we did the field sobriety tests, and this is how he performed on them. And the judge will authorize a search warrant if he believes that there's a reasonable basis to authorize a search warrant to take the person's blood, and at that point you're ordered to submit to a blood test.
You have to weigh the efficiency of what you're doing now compared to what it would become, and if that could or have a possible cost savings. And I know some of the states like Arizona, they have reasons that their officers are trained as phlebotomists. They have very remote areas, and they could be, say, 3 or 4 hours away from a hospital. That presents some unique challenges.
The reason this issue is coming up in Napa, according to the articles, is they're having a lot of people refuse the breath test. And if there is no number placed on your alcohol level, it's really tough to get a conviction.
So what would this new process do then?
Pardon?
What would this new training do then for the officers?
This new process would allow police officers to draw blood directly from the arrestee and then send that into the lab, and that would get you a number. How drunk were you? A .08, 1, 2, a 3, 4, whatever you are. And again, once you have a number, then you can compare you with everybody else and what the law says, and it's easier to get a conviction. Also, studies indicate that blood is more accurate than breath. And so that's why they're after blood.
Well, I know there's been some legislation to, in other states, to use blood draws and to use other things rather than a breathalyzer, because often in our state especially, the breathalyzer gets thrown out or it's questioned, and law enforcement has many other tools, though, they can use in a trial for conviction when they do the tests, the eye tests, and the being able to stand, balance, and that kind of thing. But other states are using blood draws, which they are taking those offenders to a place where they can do a blood draw and using the blood, which is much more reliable and seems to stand up. I'm not sure if that's going to happen in Washington State, but they are trying to do all they can to find ways to keep drunk drivers off the road. And it can be frustrating because you're hoping prevention will work, but we do have to have really prevention, treatment, law, and justice, the three-legged stool, to try and do what we can.
It is said that a person who refuses a breath test can be ordered to submit to a blood test if a search warrant is obtained that authorizes that. And I mean that's the law of the state now. So unless that's challenged to the U.S. Supreme Court on the basis that this is an invasion of privacy or right against self-incrimination or illegal search or seizure. I mean, there's some constitutional issues that could be brought up, but I don't know if the Supreme Court will hear that, the U.S. Supreme Court will hear that case or not. But I mean, as of now, the law is that you can be ordered to submit to a blood test if you refuse.
We're in the studio with Rich Kresge and Katie Pataski to talk about this issue in greater depth. Katie, Rich, how are you doing today?
Yeah, that's
doing
good.
Pretty good. Good, good. Katie, is the benefit of this practice worth the cost?
I don't see any harm of it. You know, after doing the research and going through the interviews, I can only see the benefits. It's cost effective. I mean, in the articles by the Idaho Press Tribune, they say it's saving about $300 per blood draw. It streamlines the process. It goes straight through the police department instead of having to wait in the hospital, so that only increases the accuracy of the blood draws. And these officers are trained just as well as any other medical professional. They can only help the process.
Rich, what do you have to say to that?
You know, as far as being cost effective, at what point does the numbers outweigh the cost of what it is? I mean, these are police officers whose job it is to serve and protect the people of their constituency. Their job is to be police officers, not to be medical professionals. The courses and the training that they're giving are those crash courses, and they're not medical professionals in their daily lives. In their daily lives, they're police officers. They're out arresting people and protecting people. And their job is not to be trained medical professionals.
Sure.
And so, you know, yeah, it saves a few dollars, but
it's kind of blurring the distinction between them.
Right.
Right. All right. Well, Katie, jumping right into it, Rich is saying that they're not getting enough training, and what I understand, it's kind of a crash course that they're giving. Is it possible that these police officers are not getting enough training?
Well, I think they're going through the proper channels for it. You know, they're given the same exact curriculum as any other medically trained phlebotomist.
It's a tricky word.
I know. And it's just a shorter amount of time, more narrow curriculum. So they've gone through the same process. They know the techniques.
Is there a problem with them doing it in the field of medical risk because the environment is not sterile?
I mean, that may be a possibility, but in a place like Nampa, Idaho, for instance, where the police department is training officers there, medical officials are saying at a hospital that's nearby that these officers are safe. They've gone through the proper training, so there's really a low liability.
Okay. One last question for you, Katie. Is this a violation of individual rights? Does this constitute a use of force by police, and if so, how is it justified?
I wouldn't think so. I don't think it crosses over into anything that's out of the question. It goes through the same legal channels. A DUI suspect is given the option of breathalyzer. If they refuse it, then they're given the blood draw. If they refuse that, same penalty. You can lose your license for up to a year, but these officers have to go through the same process of obtaining a proper search warrant from an on-area judge. So it really is done legally and in the proper manner. All right.
Well, Rich, on the other hand, there as well, drunk driving is a major problem, and
absolutely,
law enforcement, you know, if they're not given more tools to go after drunk drivers, what can we do to reduce the number of victims that drunk driving claims each year?
I think if you look at some of the stuff that's being used, use it in more levels. Things like the extra patrols for drunk driving that our state patrol is doing. Things like random checkpoints, like that, only used in greater number, as opposed to having blood taken, from. It's a police officer drawing blood out of your body, sticking a needle into you, pulling blood out, as opposed to random checkpoints where the breathalyzers are used and the patrols.
So
where
kind
they
of
watch for
using
drunk driving.
established methods, but maybe
ramping them up,
using them more often. And,
yes.
And okay. So how is this different than a breathalyzer? Why is this a violation of what officers should be doing?
Because when you use a breathalyzer, you're not sticking anything into your body. They're not sticking it into your body. And I want to be clear, after the research, I'm not against the blood draws. What it is the officers doing the blood draws. I believe, after doing the research, that it should be a medical professional doing the blood draws, because at what point is it too much?
Makes a lot of sense. Drunk driving, I think we can all agree, is a very big problem. Thank you very much, both of you, for talking to us today. Voter turnout for elections in non-presidential years is abysmally low, but your votes do have an effect. Whether Referendum 71 passes or not is still in the air because a handful of votes could easily push it one way or the other. Will our state's government adopt a policy of issuing in-the-field phlebotomies? It may end up being up to us and up to you. So thank you for tuning in, and good night.